Hi, my name is Cammy and I'm the nurse practitioner from Skin Renew. And this is Sina. He is our pharmacist from Greenleaf Apothecary. And you are watching this video because you are newly prescribed some GLP-1s. So we are going to go through with you how we are going to draw up that medication and how to inject yourself. So when you receive your shipment for your medication, it will come in a little foam cooler with ice. That medication does need to stay cold in your refrigerator. So make sure as soon as you get that, and make sure you get that into a cold environment. So we will go through just kind of, you'll receive a little vial like this. It will have either a little seal or a pop top on it. You will peel that off before you begin to draw up your medication. So we'll just kind of let Sina go through how this works and how we draw up for your dosing.
All right. In your package, you will have the medication that's typically in a vial, alcohol swabs, as well as a sub-Q syringe. Your syringe will have two ends. One is the plunger end. We're gonna go ahead and remove that. And then the other end is the needle end, which has a orange cap on it. First thing we need to do, we need to be in a place that's doesn't have any clutter and it's clean. And we're gonna start by cleaning. Like Cammy said, if there's a seal on it, you need to remove the seal. It's usually a silver seal. Once you remove it, you're gonna clean the vial using this type of motion, just one time. And you're gonna wipe off the top of the vial. The vial is now clean. After that, you're gonna move into the next step. On your vial, your provider has decided how many units you need to give yourself. This syringe is in units, so you're gonna draw air, just simple air. Before you would remove the orange cap, you're gonna, let's say in our example, we're gonna take it to all the way to 10 units, for example, all right? You're gonna draw air, and then now you're ready to remove the orange cap. At a 90-degree angle, you're gonna insert the stopper. You're gonna flip it around, push the air inside the vial, and remove the appropriate dose. All right, now you're ready to inject. And a sub-Q injection means under the skin. I'm gonna lay this down so that it would not touch the table. The needle is where you're gonna inject yourself and needs to stay clean throughout this process. So let's lay down the syringe for a second. Next step we're gonna do, this represents the site. A sub-Q injection, a typical place where you give yourself a sub-Q injection is around the belly button. So you're gonna clean the site and then pinch the skin and take your syringe and inject. This would be 90 degrees. You're gonna go in at a 45-degree angle. And then slowly inject the medicine. And now you've given yourself a sub-Q injection. Next step would be how to dispose of it. Typically, if you have a sharps container, that's great. If you don't, you can dispose of it in a, typically use a coffee container or anything. Basically, you're trying to protect anybody who would handle the trash, so dispose of it appropriately. Typically, it's disposed in a sharps container.
Injection sites. So we recommend with each injection each week, you pick a day that you want to do your injection. Like, say you want to do Wednesdays. I also recommend rotating your site. So a good place to do your injections is like at or below the navel. You can do them on your thighs and you can do them on the backs of your arms. So rotating the site is always good. Other than that, if you have any questions, please feel free to contact the spa and they will do their best to answer those questions for you. Okay, thank you so much.